10 signs of depression you should not ignore. Unhappy things happen to everyone, but if you are feeling dark, uneasy, or hopeless on a daily basis, you could be suffering from depression. Depression is considered a critical mental condition which can lead to many serious consequences if it isn't treated in time. It is a common mental illness that takes over 42,000 lives each year and causes one death every 12 minutes by suicide. It is more common in women instead of men. Depression may be caused by a number of things like medical conditions, drug addiction, or by mental stress due to divorce or any other emotional trauma. According to recent researches, depression can even be caused by vitamin D deficiency. The worst thing about depression is that most of the time the person suffering from it doesn't even know about his illness. Even worse, it is a mental illness about which most of the depressed people generally don't talk at all to anyone because they feel that no one would understand what they are feeling. So what are the signs of depression? How do you even know that you are suffering from depression? So in this video, we will discuss all the signs of depression you should be looking for. Appetite and weight changes. People with depression or anxiety often go through rapid weight loss or weight gain. The response to depression varies among all the people. Some people take stressful situations by overeating, and some people respond by not eating at all. And you won't even consider it at first instance because your body is more directed towards overthinking rather than noticing your weight changes. So if you find your old clothes becoming tight or loose in a short period of time, you know something is not right around. Insomnia. It is a post-traumatic stress disorder. It can sap your mood, energy level as well as health. For the insomniac patient, it's hard to fall asleep. It also includes waking up at night, sleeplessness, tiredness, dizziness, or waking up too early, which affects daily activities. Insomnia and depression often go hand in hand. Although just 15% of people with depression sleep too much, as many as 80% have trouble falling asleep or staying asleep. Patients with persistent insomnia are 3 times more likely to develop depression. Anxiety. While depression hasn't been shown to cause anxiety, the two conditions often occur together. Symptoms of anxiety can include feeling tense and restless, feelings of anger, rapid heart rate, rapid breathing, increased or heavy sweating, trembling or muscle twitching, trouble focusing or thinking clearly about anything other than the thing you're worried about. Anxiety while taking an exam is perfectly normal, but if it is happening on a daily basis and you can't find the cause of it, it becomes a sure sign of depression. Fatigue. Depression often comes with a lack of energy and an overwhelming feeling of fatigue, which can be among the most obvious symptoms of depression. This can either lead to excessive sleeping or nighttime insomnia. If you have lost interest in things you used to love doing before, get tired easily doing physical activities you used to love, then maybe it's because of depression. Short-term memory loss. Depression affects the part of the brain that bears memory and emotions. People with depression are usually unable to make decisions. They often forget things, or even the food they just ate. One moment, you may find yourself thinking about one thing and the very next moment, the other. If you forget about things quickly, even the most important things you may not want to forget ever, then it can be a sign that you are suffering from depression. Feeling emptiness. Experiencing continuous sadness, hopelessness, or guilt for every single thing, or for one thing, that lasts for weeks is a sign of depression. Feeling degraded, complex, or lesser than others can lead to illness. Staying at the home watching movies, rather than enjoying out with friends, will gradually lead to staying alone or self-isolation, which can even exaggerate depression. Cardiac diseases. For people with heart disease, depression can increase the risk of an adverse cardiac event such as a heart attack. For people who do not have heart disease, depression can also increase the risk of a heart attack and the development of coronary artery disease. The reason for this is continuous stress and overthinking. Continuous stress and overthinking in a heart patient can lead to some horrible consequences like sudden cardiac arrest. Studies also show that the patients suffering from depression undergo constriction of blood vessels, which can also cause cardiac diseases. So either directly or indirectly, depression is not good for your heart at all. Increased pain sensitivity. Does it ever feel like your nerves are on fire and yet you can't find any physical reason for your pain? As it turns out, depression and pain often coexist. While suffering from depression, everything starts hurting more. According to Healthline.com, a study in 2015 showed a correlation between people who are depressed and decreased pain tolerance, while another study in 2010 showed that pain has a greater impact on people who are depressed. Suicidal thoughts. Having suicidal thoughts is the most common sign of depression. A person with depression often thinks of doing dark things. He feels sad and anxious at times and thinks of hurting himself. Suicide is the second leading cause of death in people 15 to 29 years old. They often get suicidal thoughts of killing someone else or doing immoral acts. People who don't seek medications often commit suicide. The reason behind suicidal thoughts is the link between depression and the limbic system of the brain that affects emotions and memory. So if you are having suicidal thoughts, seek medical attention immediately. Share this thing with your close friends and family members. Don't get hopeless. This is just a disease and can be treated by medication just like any of the other diseases. Getting ill more often. Do you feel you have started becoming more ill than ever before? Well, it can be due to seasonal changes, but depression can be the cause of it too. Actually, depression weakens your immune system. And weak immune system equals to more diseases you are going to have. If you or someone you love is experiencing depression, don't be careless. It can be treated in time, or it can lead to death. It can be treated with medications or therapy. There are approximately 30 types of antidepressants available just for this disease. Contact a mental health provider or psychiatrist as early as you see the signs of depression. Be kind, show some love, listen to them. Depression is really the darkest phase of life, which begins with stress followed by anxiety, and then a stage is reached when the person feels completely shattered and hopeless. Just remember one thing, depression is just a disease like the rest of the diseases. It can be treated with medication and psychological therapy. We should have a sense of acceptance, accepting depression as a normal disorder and accepting that we all are perfectly imperfect, and that's perfectly all right.